The effects of heat and freeze-thaw cycling on naloxone stability. This is printed in the Harm Reduction Journal. Introduction. In North America, opioid-related overdose is the leading cause of death in individuals between the ages of 18 and 35. In 2016, there were 2,816 opioid-related deaths in Canada, with approximately one-third occurring in Ontario. Since 2003, the rate of opioid-related deaths has more than doubled. In response to this crisis, prescription requirements for naloxone, an opioid antagonist used to reverse opioid overdoses, was modified in 2016 by Health Canada and the National Association of Pharmacy Regulatory Authorities. These changes permitted Canadians to access the THN without a prescription, and also expanded the description of who is eligible to receive a naloxone kit. Currently, several jurisdictions in Canada, including Alberta, Ontario, Northwest Territories, and Yukon, offer unrestricted access to THN to anyone at risk of an opioid overdose, or those in a position to assist in an opioid-related overdose. The availability of THN outside of healthcare settings raises concerns regarding naloxone stability when exposed to conditions outside of the 15 to 30 degrees Celsius range, as indicated in the product monograph. For example, individuals often inquire about the possibility of THN kit storage within their vehicles for accessibility. Storage of THN kits outside or in vehicles may be problematic due to extreme and fluctuating temperatures among the seasons within Canada, but may impact naloxone stability and therefore efficacy. Expiration date and storage conditions are determined by satisfying the International Conference methods. To assess the effect of heat, naloxone hydrochloride ampules were exposed to 80 degrees Celsius in a temperature-controlled oven for 8 hours, followed by 16 hours at room temperature. To assess the effect of freeze-thaw cycles, naloxone hydrochloride ampules were exposed to negative 20 degrees Celsius for 16 hours, followed by 8 hours at 4 degrees Celsius. The impact of these conditions on naloxone hydrochloride stability were evaluated each day for 1 week and after 2 to 4 weeks. The concentration of remaining naloxone hydrochloride was quantified using high-performance liquid chromatography. Naloxone hydrochloride ampules stored at room temperature served as the experimental control. Results. Naloxone hydrochloride ampules exhibit no changes in drug concentration following exposure to heat or freeze-thaw cycles for up to 28 days compared to ampules maintained at room temperature as indicated in the product monograph. Conclusion. Naloxone hydrochloride remains chemically stable following exposure to heat or freeze-thaw cycles after 28 days. If THN kits are stored in non-standard conditions for up to 28 days, the active naloxone is likely to remain stable. Despite this, pharmacists should continue to emphasize the importance of appropriate storage of THN kits to ensure optimal efficacy should naloxone administration be required in an emergency situation.